We are honored today to have Dr. Grant-Coons to present for us today. Let me read a little bit about him. Dr. Coons got his master's degree in clinical psychology from Antioch University in Los Angeles and specialized in LGBTQ Affirmative Therapy. Went on to get his doctorate in clinical psychology from California School of Professional Psychology in Los Angeles with an emphasis on multicultural and community psychology. He was trained at several agencies, including the AIDS Project Los Angeles, the Los Angeles LGBT Center, and the Los Angeles Children's Hospital High-Risk Youth Program. He was the lead clinical supervisor at the D.D. Hirsch Mental Health Services Suicide Prevention Center in Los Angeles and facilitated groups in suicide attempt survivors and providing suicide prevention training all across the United States and Canada. He currently has a private practice and a private practice psychotherapy center called Empowered Living Therapy in Midtown Sacramento. Thank you for presenting for us. We welcome you here.
Okay, good. I really appreciate you all inviting me here today to talk about this topic. You've heard a little bit about my background of how I came to be interested in this topic and how I came to talk about it. So I won't go over that again, but just to touch on that with my training really being centered around LGBT affirmative therapy, and then on to D.D. Hirsch, where I spent almost 2 years as their lead clinical supervisor, really focusing on supporting suicide attempt survivors, running the really only evidence-based group for suicide attempt survivors in Los Angeles, and touring the country doing suicide prevention trainings, as well as training people on how to run the attempt survivors group. And then 3 years, almost exactly, I moved to Sacramento, California, where I opened my private practice, Empowered Living Therapy, where I predominantly see LGBTQ clients. I also have a support group for gay men over 40. So professionally, the topics I'm going to discuss today are really at the heart of what I do the most and what I feel the most passionate about. It's also personal for me. So this is me at age 4, roughly. And I put this up there to give you a little background and to also start to talk about some of the themes we're going to be addressing today. So there I am doing some gender non-conforming behaviors. This was a cheerleading skirt that my mother had and I fell in love with. And at this point in the picture, my mom thought it was pretty cute, so she took a picture of it and still have this picture to this day framed in my house. But shortly after this picture was taken, my parents became a little concerned about how much I liked this cheerleading skirt. And she started to hide it from me. But being a pretty precocious little 4-year-old, I found it wherever she hid it. And eventually she threw it away. And what I remember about this time in my life is it was the first time I ever got the message that there was something wrong. And there was something wrong with me and what I liked. And I didn't understand why, because this was not something I really thought too much about it. I just liked it. But it was the first time I got a message from the environment that this was not okay. And this was the beginning of internalizing many more messages throughout my life of what it means to be LGBTQ. For me, in particular, identifying as a gay, male-identified individual. So what I want to do first is to talk a little bit more about the other acronym, or the other letters in the acronym, because I want to give you the understanding of how diverse, how much variety is in this community, and even though there are some similarities in how we group all these individuals together in this one acronym, and there's many more letters I've actually left off. But what's more important is that there are so many differences, there's so much uniqueness, and it's important to get a general understanding of what identities exist, to have a better understanding of how to work more effectively with anyone in the LGBTQ community. So I'm first going to start with sexual identity. So sexual identity are identities that are based on who you are attracted to, either sexually or romantically. And this is just this is not even scratching the surface. Identities are evolving all the time, especially with every generation coming up. They take identities and create their own understanding, they create their own labels, and so it's an ever-evolving process, individually and community-wide. So some of these you might be familiar with, some things like gay, lesbian, both are individuals that are attracted to members of the same gender, whereas heterosexuals are attracted to members of the opposite gender. But there's some that you might not be as familiar with. Sexual fluidity is a term that is trying to get us away from what is considered the binary understanding of sexuality and gender. Binary meaning that there is one or the other, male or female, gay or straight. And so those that identify in the sexual fluidity category are trying to break out of that and give us more of an understanding that these identities don't exist in one or the other box neatly, but that there is a continuum, that it can change, that fluidity means it might be different over time, and that identity is not necessarily fixed. Similar is pansexual, so individuals that are not attracted to, well, let me say it this way, those that identify as anything not heterosexual and attracted to individuals based on who they're attracted to, not based on gender, not based on any specific identity, but that it can change and that it can be various. And examples like asexual, so those that identify with no sexual orientation, either sexual orientation or romantic orientation. And terms like MSW or WSW that are more clinical terms, specifically MSM, men who have sex with men or women who have sex with women. I came across this more in my work with HIV prevention and treatment, and this would be an identity that's based more on behavior than it is on an identity like gay or straight or lesbian. So a lot of terms out there, a lot of variety, a lot of the diversity, and this is just hopefully going to give you a curiosity to continue to explore, to ask questions, to think about it, because you're not going to, through this presentation, be an expert on sexual identity or gender identity, and maybe we never will. But more importantly, to continue the conversation and continue to ask, especially the clients that we work with, what does identity mean to you? What does sexual identity mean to you? And be open to new understandings, new ideas of what identities could be. So I separate this from gender identity, which is a very different continuum. So sexual orientation, again, who you're attracted to. Gender identity is how you understand your own gender. Now, the important distinction between sex and gender is that sex involves more of the biology. These are the things that we can't necessarily control. We are born with these, with this already determined for us. So the body parts that we have, the chromosomes that we have, the hormones that we have, this would all fall under the sex category. But this is different, and this can be difficult for people to understand. This is very different than gender, which is all made up. So gender is how we understand, or what meaning we place on sex. And we know this is made up because we can look at any time in history and see the variety of gender. We can look at any culture and see the differences in gender. There was one time that wearing high heels and powdered wigs and makeup and pink was masculine, and that men wore these because that's what it meant to be a man as far as gender identity is concerned. Today, that would not mean the same thing, right? So gender is about, if you are born a certain sex, what hair styles do you have? What clothes do you have? What toys do you play with? What cheerleading skirts do you put on? right? And this is what society says is okay and what's not okay. And so this is helpful to understand the difference when it comes to identity as far as someone that is born a certain sex but understands their gender differently than how society would say they should be. Or when we look at identity that's based in sex, meaning biology, meaning someone that is born with both sets of sex organs, this is someone with a different gender experience that's based on sex rather than what society says their gender identity should or should not be, right? So again, a lot of different ways of understanding these particular identities within this very large community. And again, more terms up here, things like cisgender. If you're not familiar with that, this is actually the term that the transgender community gave those of us that were born in sync with our sex and our gender. So born with male parts, identifying as male, that's a cisgender person, and vice versa with a woman that identifies as female. This is different than someone who's transgender, that was born one sex but sees their gender identity differently. Versus someone who is transsexual, that's typically someone who experiences what's called gender dysphoria because they feel that their body does not match who they are, and they may take medical interventions to correct that, right? Also though, transsexual is not necessarily a term that everyone responds well to. And so when we are working with the clients that we're working with, some may apply that label and see that as an accurate description of their life experience. For others, that would be an insult. Based in that it's more of a medicalized term. Similar with homosexual. That this term, depending on the generation, will have different reactions. I don't hear a lot of younger generations using this term. I've had older generations, professors of mine, react very negatively to this term, again, because it was based in a medicalized identity of same-sex love. And so it really depends on how this person applies the label or does not apply the label to themselves. And again, there's no right or wrong. We just ask, we just explore to figure out what fits them and their understanding of their life experience. And this goes on and on. Cross-dresser is typically a heterosexual man that likes to experience their feminine side. And that is not someone that has gender dysphoria. That is not someone that wants to change their body, necessarily. That's someone with a very different psychology that we would work very differently with. Okay? Sure, sure. So, like the identity of a cross-dresser, the derogatory term would be transvestite. And this would be a very different experience of gender, because this is typically a heterosexual man that identifies and wants to express gender expression, a more feminine side. So they'll wear women's clothing, but they don't necessarily feel like they're in the wrong body, as someone that identifies as transsexual or transgender may. Okay? So a lot to dig into, a lot to be curious about, and a lot to accept that we're not going to understand, and that we're not going to know all the labels that exist out there, and that they're going to change, and that we just keep open-minded to what these identities mean. But what they all have in common is that they're rooted in attraction, or they're rooted in gender and gender identity. If you're a visual person, this might be a helpful way to understand this. So these are different continuums of some of the terms that I've talked about. So sex, and if you're on one side of the extreme, you would have the XX chromosomes, meaning female. If you were XY chromosomes, you would have male body parts and physiology. And if you were in the middle, you might identify as intersex, right? Born with both physiological male and female parts, chromosomes, and even that there's variety. It's not like 50-50, right? That can present as many different forms, and is a very different experience, life experience around gender and sexuality as compared to someone that was born with XY or XX but has a different understanding of their gender identity, which one extreme would be male, one extreme would be female, and right in the middle perhaps would be transgender. Now again, going back, and this is where this all gets really interesting and complicated and you know, why we remain curious about it, is that this is still in the binary. This is still looking at one side or the other, whereas there's other communities that don't use this at all to identify their gender or sexuality, right? Because it doesn't fit on this continuum. It fits on the whole continuum, or it fits on a different continuum, or it fits on multiple ones, right? And then orientation, so gay, straight, and in the middle, bisexual. Okay? So having an understanding of who these people are that we're talking about today. Okay? And so kind of touching on the last part of the acronym, the Q, the queer questioning. Yes, question? So non-binary would break this continuum up, because non-binary doesn't fit with one extreme or the other. They might be on the whole continuum on different days. They might identify as male, they might identify as female on a different day, or they identify as both at the same time, or they identify as none of them. I have one client that's agender, and she goes by female pronouns, and the way she described this is because it's just easier that way. She didn't really care. But she doesn't identify really as male or female. She just doesn't feel one way or the other. And so she doesn't identify with any gender. And so that label of agender. So non-binary, more with younger generations starting to break out of some of the older labels or the more current labels and creating their own, and also breaking up the binary with things like queer. Genderqueer, meaning queering the lines, queering those continuums, not having finite boundaries around gender and sexuality. Now again, it's a very interesting topic, especially in my gay men support group over 40, to talk about the word queer. Because growing up, and in my time growing up as well, this was not a nice term to hear. Right? This was insulting. This was derogatory. And so some individuals hear this term and they flinch. They don't like it. Whereas typically with younger generations, they didn't have that experience of the word, and they've redefined it for themselves. And so queer, trying to step out of the gay or straight or bisexual box and saying, hey, I don't want to be identified as any of those. I want to have a more fluid identity. I want to have one where you don't put a label on me or put me anywhere, that I can go wherever I want and decide who I am depending on how I feel. Gender fluid and agender, as I mentioned, and then questioning that catch-all box that's really helpful actually in clinical work for those that really don't know yet. And they just need something to identify with that helps them explain their life experience currently, which is that of exploration, that of I don't know, right? And being able to help them walk through that exploration to help them figure out if they want to apply a label. And if they do, what label? And do they want to create a whole new label? Okay? So, kind of giving a brief overview of who is in this LGBTQ plus community and how very diverse it is. So, what I next want to talk about is what does it mean to be one of these individuals in the world that we live in? What's that experience like? When you grow up, and before you even identify as one of these, what are the messaging, what is the messages that you start to get about what it means to be you? All right? So let's talk about stigma. So some of these terms you might be already familiar with, homophobia, biphobia, transphobia, the fear of someone who is gay or bisexual or transgender. However, this term had a lot of criticism because it didn't really describe the reality of what actually is happening. Because if we go literally with what a phobia is, That would mean like arachnophobia or claustrophobia, meaning I'm around a gay person or a bi person and I have a panic attack and I run away, right? And I need exposure therapy in order to get over my phobia of gay people, trans people, or bi people. But what it's missing, and Dr. Herrick in the early 90s talked about a new term, heterosexism, that he thought better described the actual reality, because what it also included, which the phobias did not, is the element of power and the element of oppression that phobias don't have. You're not oppressed by spiders. You're not oppressed by heights. You're afraid of them, but you're not oppressed by them. Whereas racism, sexism, that has an element of power over. That has an element of oppression. And so heterosexism, he felt, better defined the reality of what we're really talking about. And cisgenderism, again, being a term applying more to those in the transgender community that feel that type of oppression, that type of rejection about their gender identity. So heterosexism and cisgenderism, specifically stigma related to those who are not heterosexual or cisgender. And then lastly, this term of internalized stigma, and that's what we're really going to talk a lot about today, because when we internalize this stigma, internalizing the stigma is what is at the root of a lot of the issues, a lot of the mental health issues, a lot of the reasons why suicide becomes an option. And so, to better explain it, I'm going to show you a short clip of someone that I think does a far better job at explaining the experience of internalizing this stigma. So I think she does an amazing job at describing what that's like, to grow up in a sea of negative messaging about being LGBTQ and what that does to a child. Seems like my animation is not working on my PowerPoint. I don't know if we're going to be able to fix that. What I wanted to show you next was I went through a few months of my Facebook feed, and anytime I saw an article that related to stigma, I cut it out and I put it in the presentation. I started it last summer. I was going to put like 3 or 4, but they kept coming up. So let me go over some of these articles. So trans boy commits suicide after school refused to use his name. American pastor blames California wildfires on advancement of LGBT rights. 10 countries where homosexuality may be punished by death. Sacramento Baptist pastor praises Orlando massacre. Gay couples say they were stabbed for holding hands in Denver street. Gay activists in Russia arrested for celebrating Pride. Rainbow crosswalk vandalized with swastikas in gay village. GOP congressman says kids are better off in orphanages than with gay parents. GOP candidate, vile and perverted LGBT people cannot reproduce, they have to recruit. Trump administration signals that it'll look the other way on LGBT discrimination. Remembering all the trans individuals who have been killed in the US this year. University of Pennsylvania student murdered, left in shallow grave because he was gay. Father kills 14-year-old son. He would rather have a dead son than a gay son. And then parents torture and kill 10-year-old after he says he likes boys. So this, if you think about it, goes beyond just playground bullying, right? This is terrorism. This is, it's pretty brutal. And so hopefully you're really getting the impression of what a child will be absorbing. So let's talk about how this affects your mental health and how mental health is related to suicide. So 90% of suicides can be associated with a mental illness. And depression and bipolar disorder are the two largest categories that are associated with suicide. Depression and bipolar disorder being the main two in the mood disorders. And what's interesting about studying these mental health, particular mental health issues and suicide is how different they present. So bipolar disorder is an interesting disorder when working with suicide because in depression, someone that is in the depths of their depression really wants to commit suicide at that moment, really wants to die by suicide. However, they don't have the energy. But when they start to go into their manic episode, it may present to us that they're doing better. They have more energy, they say they're feeling better, but at that point is when it's the most dangerous, because now they have the energy to act on their thoughts of suicide. So it's really when they're coming out of the depression into their mania that they're at the highest risk, and that's when we need to check in and we need to assess. Anxiety disorders, particularly panic disorder, PTSD, are the highest as far as suicide goes. Psychotic disorders are interesting because of what leads someone to suicide into psychosis looks very different. They tend to be more, their reasoning tends to be more psychotic in nature, but their attempts tend to be more violent, tend to be more brutal. And substance use is the kerosene on the whole thing. The majority of people that attempt suicide were intoxicated at the time of their attempt, and so it lets down that guard that's between the thoughts and the action that influence someone to cross that line. And so substance abuse, substance dependence, and when we're talking about these mental health issues, it's not just one that someone may be suffering with. We're talking about multiple ones at a time, anxiety disorders and depression and substance use. So when we're talking about mental health, we are talking about assessing for suicide, since it does have such a strong correlation. Now this is where we connected with LGBT, because LGBTQ individuals are almost 3 times more likely than others to experience a mental health condition. So if they're more likely than the general population to have a mental health condition, and then those with the mental health condition are more likely to die by suicide or attempt suicide than LGBTQ people are more likely to attempt or die by suicide. An estimated 20 to 30% of LGBTQ people abuse substances compared to about 9% of the general population. 25% of LGBT people abuse alcohol compared to 5 to 10% of the general population. So it's just, of course, with the stigma, with internalizing the stigma, with it causing mental health issues, we're going to be talking about a higher risk for suicide. So let's talk about LGBTQ and suicide. So this is Layla Alcorn. She died by suicide because her parents would not acknowledge her gender identity. LGBTQ plus individuals are approximately twice as likely to report suicide ideation. Rates of suicide attempts are 2 to 7 times higher among LGBT populations, 4 times greater for LGBT youth and 2 times greater for questioning youth. And half of young transgender people reported suicide ideation and a quarter made a suicide attempt. It's really, really shocking with the transgender community how high the risk of suicide and a suicide attempt is. Yes?
Is that in adolescents as well as adults across the board?
Great question. So this is specific to the Trevor Project, so this is more related to transgender youth, but as far as the transgender community goes, the numbers are similar as far as any age and as far as the risk level. Suicide death question mark. Well, we don't have a lot of data on actual suicide deaths because we can't find out someone's identity after they died. And so we can't know for sure who was LGBTQ, for sure, when it comes to exactly how many people who are LGBTQ died by suicide. We can know attempts, we can know suicide ideation because we can talk to people, but we can't know specifically about deaths. So if you've never had a thought of suicide, if you've never worked with anyone that has ever thought of suicide or had a suicide attempt, this is meant to help you put yourself in the shoes of someone that starts to think about suicide as an option. So this person represents anybody, and this arrow along the bottom here represents time, looking into the future. So this person is standing, looking into their future, no obstructions. So my first question to you is, what do you look forward to? And you can just shout it out. What do you look forward to in general? Time with family. Family. Celebrations, events, anniversaries. What else? Writing that book. Absolutely. Meetings. Yes. Work. Yes. Things we're passionate about. What was that? Vacations. Absolutely. Lunch. Absolutely. These are all things that we look forward to that give us happiness. There's many, many more. But my next question is, what stresses you out? Too much to do? How was it to put together this meeting today? Was there any stress involved? Not too much? Okay, well.
There were a lot of us who worked together.
Yeah. So that's really helpful in decreasing some of the things that stress you out, is having good support systems, having people that work well together. Sure. What else? What else stresses you out? Yeah, the work that we do, the other people's stress. Absolutely. What else? Health, family, right? Money. So some of the things that we look forward to, like family, like vacations, like our work, right? Like money, are the exact same things that can stress us out. Now, if you have one of these things, like work's a stressor, that's all right. I mean, this person looks like they can still see their future. They're not obstructed by the stress of work. They're okay. But what starts to happen is when these things pile up. So stress caused by work, but stress also caused by the people in your life. Stress caused by money. Stress caused by mental illness, either that you experience or maybe family members, people that you love. Loss in general. Health, physical health. Family. And then identity, which I put as the biggest, because today we're talking about the stress that comes with these particular identities. So now, this person has an issue. They can't see their future anymore. They can't see beyond the pile of stress that's in their life. They're obstructed from that. So what happens when stressors pile up? We have a restricted perception of the future. And so now we're starting to feel trapped. We're feeling like we've tried everything to deal with our stress. There's nothing that we can do about it. It's still there. I don't have any hope. I don't have any hope that it'll be different. And so what do I start to think about is, how do I get out of this? I might have tried other things. I might have gone to therapy. I might have talked to friends, but nothing's working. And then it gets to a point where maybe the only way out of experiencing this stress, this pain, is to die. And so suicide becomes actually a solution for an immense, unbearable amount of pain. This is why the notion and the myth of suicide being a selfish act is really problematic, because it's really not the experience of someone that is experiencing thoughts of suicide. The comments I typically have heard is that they feel that they're doing people a favor. The quote I got from a client was, yeah, people will be upset at first, but they'll get over it, right? I'm such a burden. Dr. Thomas Joyner, one of the leaders of suicide prevention research, talks about these components of what starts to encourage someone to think about suicide. One huge one is a burden to others.